A very good evening to you. And yes, thank you for joining us again on another very informative edition of Gyna Plus right on Afia TV, where we discuss health issues that affect girls and women in the society. Last week on the show, we started a conversation on sexually transmitted infections, what you need to know. And of course, my guest, Dr. Chika Ezekwere, did a wonderful job. By the way, my name is Doris Mayim Shishe, and this program comes up every Wednesday at 6 p.m. with a repeat broadcast on Saturday at 8 p.m. And today we will continue with the discussion on sexually transmitted infections. Do stay tuned. We'll be right back after the break. Welcome back. If you just joined us, this is Gyna Plus right on Afia TV, and this is where we talk about health issues that affect girls and women in the society. And like I mentioned in the beginning, last week we started a conversation on sexually transmitted infections, and we talked about quite a lot. And of course, we decided that this week we will continue with that conversation. This is a part 2 of it. And my guest was, and still is, Dr. Chika Ezekwere, who is the Senior Registrar of Obstetrics and Gynecology Department, University of Nigeria Teaching Hospital, Ituku Ozalla. Doctor, it's good to have you back again. It's not like you left anyways.
Thank you, Doris.
I mean, welcome. Last week, it was quite an interesting session for me. I mean, I learned so much and I want to continue learning again. But before we get into some of the things that we didn't talk about last week, take us through a brief recap on, I mean, we talk about STI. Just give us a bit of a rundown before we continue.
Okay, we talked about what STIs are, and I say they are diseases or infections that are gotten or contracted from having unprotected sexual intercourse or having intimate contact with body fluids. They can also be gotten from anal or oral sexual activities. Then we talked about the fact that, yes, women are more prone to contracting this infection because of the way the anatomy of the female reproductive system is, the genital tract being lined by very soft mucosa, which can be easily bruised, thereby predisposing the woman to getting these infections. We also talked about the symptoms. We had an overview of what the symptoms are: low abdominal pain, change in menstrual pattern, intermenstrual bleed, abdominal vaginal discharges, urinary symptoms like frequent urination pain or urination, presence of ulcers in the genital areas, warts in the genital areas, yellowish discoloration of eyes when it has to do with hepatitis B, and the various symptoms of HIV/AIDS. Oh, we also mentioned this that these diseases don't just stick to the females; it can be transmitted from the mother to the child. So we talked about the effects on both the mother and the child. For the woman, she can have miscarriages. We talked about it leading to ectopic pregnancy, cervical cancers, liver cirrhosis. For the babies, talked about prematurity, because premature babies usually have so many complications associated with birthing a premature baby and prematurity itself. We talked about congenital diseases manifesting in these babies. We also talked about it leading to stillbirth or neonatal death.
All right, thank you so much for that beautiful recap. So for this week, I mean, we didn't talk about treatment last week. I know that there are times where people will just walk up to a store and they tell maybe I don't know. I won't know if these people are people who are patent medicine dealers or we don't know. But just tell you, I'm having some itches. Maybe I feel like I'm down with anything they want to call it, and they just feel they are not okay. So, but what are the right channels to handling this in terms of treatment, in terms of diagnosis, in terms of what to do now generally?
Okay, somebody comes down with symptoms related to sexually transmitted infection. What would you do over-the-counter medications? Because a diagnosis needs to be made. So a patient, an ill person needs to see a doctor first. Now, you made mention of going to the patent medicine dealer to procure medications. What are you treating?
Like interesting.
Which therapy are you using? Is the causative organism sensitive to this therapy, to the drug you're using? Somebody has HIV/AIDS, for an instance, which is a viral infection. You walk into the store, let me use the popularly abused ampiclox, and you go buy an antibiotics. What has an antibiotic got to do with a viral infection? It wouldn't work. Then you're procuring an over-the-counter medication. What about the dosing? What about the mode of administration? So these are factors that come into play. You need to see a doctor, proper diagnosis made, proper therapy administered, proper dosage of the medication given. And you know the funny thing about abusing drugs is, if you abuse a particular drug, you develop resistance. So when the day comes when you need this particular medication, it wouldn't work for you. You go procure medication over the counter, assuming is a drug you need to take maybe 1,000 milligram, you're taking 500 milligram. You're not taking the optimal dose. What does it do?
We'll definitely find out. I mean, I like the fact that you're asking me what we should do. But if you just tune in, this is Gyna Plus, and you can see how carried away I am. Because, I mean, this is something that is very common. You walk, you just strolling, I'm having a headache, I need this self-medication. She's saying it is very bad. So if you already have it, I think you should just stay tuned because we have more, because she'll be telling us about some of these consequences and what better ways we should handle some of these things. Please stay tuned. Gyna Plus returns in a moment. Thank you for staying tuned, and I hope that you are learning as much as I am. This is still Ghana Plus right here on Afia TV, and we are talking about sexually transmitted infections today. My name is Doris Mayim Shisha, and I still have Dr. Chika Ezekwere right here in the studio, and just talked about quite a number of things. And we talked about self-medication and the impact. So, doctor, I mean, it's a good thing that you brought this up. And personally, I've had cases where people would, I mean, I've encountered situations that will tell you when you boil salt, hot water in salt, you know, put cloves, put guava leaves, sit on it, let it cook, and then the heat will come on you that it will kill all sort of infections, STI, anything, a toilet, whatever. Please, as I don't want to say this is funny, but I mean, there's a reason why we have an expert in the building. How safe are these practices, and what are the medical implications, so to speak?
Okay. Thank you, Doris. Before we went on break, I was talking about underdosing. So let me talking about that underdosing. When you take drugs that you take an underdose of a drug, what it does is it looks like it's working, but it beclouds the symptoms. So the infection process keeps is ongoing in the system. And at the end of the day, the person comes down with complications. They're talking about herbs, about all you've been cooking. What did you even mention? The cloves, the
guava leaves, salt, and hot water.
You know, the truth is, herbs are actually medicinal. That's the truth. Some of these herbs have antibacterial effects and qualities. If a woman is down with a viral infection, is the herbs with antibacterial quality or effect going to treat it? Now, talking about herbs is actually a controversial thing in our environment because a whole lot of people believe in it. So I don't want to delve into it because I'm not a herbal practitioner. But now, talking about herbs, how do you know which therapy is good for a particular disease? Does what work for gonorrhea infection work for hepatitis B infection? So if cloves works for gonorrhea, does it work for chlamydia infection? So how do you ascertain the particular herbs that works for a particular disease? Now, how do you quantify whatever you use? I might decide to use a cup of cloves. And you might end up using 3 cups of cloves. So how do we measure it? How are these herbs prepared? So I will talk from my area. Ideally, I will advise someone that has any symptom, any infection, please go see your doctor.
Now, I respect your standpoint, doctor, but the area of salt, is it safe to in any way, use some sort of salt water, sit on it? Then there are no herbs in this case. Does it still work? Is it something that it's healthy? And that's the word. I've been looking for the right word. Is it healthy to do that? Because I know this is an enlightening platform where people are learning. Not because doctor will say yes and not say again, you're not kill yourself with salt and stuff. So that's not the point. Really.
If you have an STI,
See a doctor.
see a doctor.
I saw that coming. All right, thank you so much. Now, there's a point where I also want you to talk about and how this affects, I wouldn't say people who are, I wouldn't want to call them victims, people who are down with different kind of STIs. The perception and attitude of people around, either from the health practitioners or to partners, or maybe our environment. It is often believed that once you are, some people are of the opinion that once you are down with an STI, it's simply because you lived a careless lifestyle. It's simply because you're not careful enough. Now, do you think this in any way hampers the treatment? Does it in any way, aggravate the treatment and maybe the healing process for people who are already down with these things?
The truth about our environment is there is a whole lot of stigma associated with sexually transmitted infection, and it shouldn't be so. Like you talked about a health worker wouldn't be judgmental in attending to a patient. That's why he or she is there to help the patient heal. So talking about the general attitude or the general perception, truth is people come down with STIs, not necessarily because they are promiscuous. The kind of job you do. I do a job where I'm often exposed to body fluid. So you meet a doctor and nurse that has an STI or has been infected with HIV, and you go judging that this person got it from this. It doesn't work that way. People have been sick and they've been transfused with blood and they got this thing from blood transfusion. See, people have been careless. They've done things where they share needles or they share piercing objects like razor blade. Back in the days where you used to make fixed weave on in the salon, you can get it from all this. So that somebody is down with STIs doesn't mean the person is promiscuous. We've had cases where, yes, this person has a partner he or she is faithful with, but the partner in turn has multiple partners. So you can say it's not a thing to judge someone for. And it's not a thing for someone who has an STI to go hide and allow the thing to eat him or her up and come down with complications. So generally, people have STIs not just because they are promiscuous. There are other means of getting these infections apart from indiscriminate sexual activities.
Thank you for putting that straight out there. Now, there are other issues on ground. On one hand, I'm bent on using the word itchy because this is like the common fellow ladies will tell you, I don't like the way I feel, I'm feeling itchy. And they'll tell you maybe because I share the toilet infection. Now, is it particularly the same to say that, okay, because you felt this way, it might be, and then you're not having certain discharge that is not so good, quite offensive. And you see, you just tag it, my friends that I visited, that toilet, I shouldn't have shared it. Most women don't bother sharing. Now, is it possible to, contract an STI by sharing, one's toilet? Please let me know.
Most times, what people claim to be toilet infections are actually STIs. Yeah, they are.
Meaning that they're already down with it before using that.
You don't get STIs from the toilet.
Good.
You do not get STIs from the toilet. You get STIs from sexual activities, intimate contact with body fluid, blood, saliva, semen, name it. So that's how you get STIs. You don't get it. In fact, research has proven that most people that walk into the hospital claiming they have a toilet infection, when screened, have actually been diagnosed with one STI or the other.
Okay, but yes, I mean, thank you for that, right? I'm still very curious. So, what is the thing about not wanting to use a toilet that's not hygienic? Some ladies will tell you, I don't share any restroom. So, they either halfway suspended or they can't share at all. Is there any kind of health implication that still affect them as women in this regard?
Yes.
Okay.
It's not proper to share toilets, especially in a public place. Because what you're exposed to the toilet, they're your private areas.
Okay.
I don't know if you get me. And truth is, like I said earlier, the female genital tract is a very sensitive tract. So you can use a public toilet or use someone's toilet and the water splashes on your genital area. You can actually come down with infections. That's a different ballgame.
Okay.
That is not an STI. I'm not disputing the fact that using a public toilet or sharing toilet can predispose a female to having an infection. But what I'm trying to clarify is that that particular infection is not an STI.
Okay, I mean, that's very clear now. I'm clear on that. Thank you so much. So, general myth now. I mean, we are still in a society where, of course, it seems like it's a woman's thing. Once STI is mentioned, women, women. So, but talk to us about some of these general myths. Generally, there are a lot of them that wouldn't want to go down one after the other. But on a general note, what are some of these myths? And as we go forward, how do we go about our lives? More like a general safety tip, just as we wrap up this session.
Okay, the general myth in our environment, not my portion. Everybody keeps saying, God forbid, it's not my portion. So when people just dwell in this not my portion phase, they don't do the right thing at the right time. Because early dictation, early treatment has a very big advantage. You're diagnosed early, you're treated early, you avoid coming down with complications. You also hear people say, I've had gonorrhea when I was younger, so I can't have it again. That's not true. That you've had gonorrhea in the past, properly treated, you healed, doesn't mean you're not immune to having a repeat incident or contracting other STIs. Some people tell you, I don't have any symptoms. But meanwhile, you have like 3, 4, you have multiple partners, you indulge in acts unprotected, and you don't, for such a person, going on regular check should be paramount. You don't just sit back and say, I don't have any symptoms. So that's part of the myth. Somebody will tell you, I've had minimal partners. I've only dated maybe 2 or 3 persons, so I'm not a candidate for an STI. That's not true. So these are some of the myths that people dwell on in our environment, and these myths prevent people from presenting to the hospital as at when due, prevent people from assessing early diagnosis and early treatment of the diseases.
Now, thank you so much, Doctor. As we wrap up, at what point is one expected to more like go on routine checkups? What is the pattern like? Because you mentioned the fact that these things usually do not come down with symptoms just yet. So what is that thing that will warrant me to just say, okay, walk into a health facility and say, okay, I want to check if aside HIV, which sometimes they be mandatory if you're pregnant, they'll tell you have to do your the test and all of that. But beyond that, for other ones that you mentioned quite a lot of them. Why should there be any for me to just stroll in and say, okay, I want to have this test?
Okay, Doris, you just personalize it. So let me use it.
Yes, please. Yes, please.
If you have multiple partners, don't you think you're a candidate to do a routine check? These things have, apart from the HIV, that has a window period of about 3 to 6 months. These infections, people that are symptomatic come down with symptoms in a couple of weeks. So I say that a group of people may not come down with symptoms doesn't mean that there are not people that come down with symptoms. Because I just noticed you keep picking on the asymptomatic group over the symptomatic group. So every adult knows him or herself. If you indulge in practices that predisposes you with coming down with these infections, you should do a routine check.
And of course.
If you're symptomatic, you have symptoms, you should do a routine check. Just like the popular adage in our environment, the earlier the better.
And of course, self-medication is what we talked about. In our last edition, I think it was this week, we talked about the fact that you shouldn't self-medicate.
Yeah,
Walk
that's
into
not
a
an
healthcare,
option.
see a doctor. Thank you so much, Dr. Chika. It's been an eye-opening session for me. I mean, I'm sure that some other persons learned so much on this edition. Thank you for coming around.
Thank you.
Of course, we had Dr. Chika Ezekwere, who is a Senior Registrar of Obstetric and Gynecology Department, University of Nigeria Teaching Hospital. And we were talking about sexually transmitted infection. You heard it all for yourself. Do not take matters into your hand. When you feel like you're not okay as a person, why not walk into a health facility and see a licensed medical doctor, not over-the-counter personnel who will give you some drugs so you don't aggravate your issues. And I hope that you learned a lot, as we will keep bringing you more interesting topics to help you live a healthy and happy life. That's where we draw the curtains today on Gyna Plus. Thank you so much for watching. I am Doris Mayam Shisha. You have a lovely evening.